Hello, everybody. We are going to start the webinar in a few minutes. Just to make sure that everybody is able to see me, myself, I'm Sharat Kuravi. I'm the co-founder and EVP for Intuitio. Just to give you a quick overview of Intuitio, Intuitio is an AI and machine learning and data analytics software and service company. We work with enterprises, small to medium and large enterprises to provide solutions in the data analytics space. And we have services, we have a team of experts, data scientists and data analysts and data engineers that work with organizations to provide the required solutions. A few housekeeping items before I get started with this agenda today. We are going to have introductions. I've introduced myself. I'm going to have Dr. Joshi introduced here in a second. And subsequently, Dr. Joshi is going to talk about the challenges that we face in the for the healthcare providers in putting the data together to provide the service needed for the patient's health. And subsequently, I'm going to provide a quick overview of the solution that we have and that we could implement for healthcare organizations. After that, I'm going to show you a quick demo of how the solution looks like, how the screens look like, and give you an overview how it works. This will be followed by a Q&A. So if you are attending the webinar, you should have an indication in there saying where you can ask the questions. So please feel free to continue entering your questions throughout the webinar, but I'm going to take the questions at the end of the webinar. If your name is already popping up and your email address, if we have your email address, if for some reason we cannot answer your question, we're going to go ahead and get in touch with you and answer your questions. Having said that, I think let's get started here. So I want to introduce our guest speaker, Dr. Sunil Joshi. Dr. Joshi was born and raised in Jacksonville, Florida. So he's very much a Floridian. He's the president of Family Allergy and Asthma Consultants. He's also the president of Duval County Medical Society Foundation. He's also the co-chair of the 904 Mission 1 Million Project, which is a pet project of our Mayor Lenny Curry. He works very closely with Mayor Lenny Curry. Dr. Joshi, he spends his time teaching residents and medical students at the Mayo Clinic about allergic and immunologic diseases. He has appeared on the local WJXT Channel 4 morning show a number of times to discuss allergy-related issues. And also, he frequents the show to answer any questions related to medical segments. So Dr. Joshi is very well known in the community. We are very fortunate to have him here today talk to us. So I'm going to ask Dr. Joshi to please give us a quick overview of, as a provider, as somebody who owns a practice here, what are some of the challenges in getting a good data put together and the information about the patient's health? Dr. Joshi?
Yes, thank you, Sarah. Thank you for the nice introduction as well. It is an interesting topic because in medicine, what has happened, of course, is over the last 10 years, most practices have now shifted towards electronic medical records, which does, to some extent, make things easier, but it also makes things very difficult. You know, whereas before we would be able to shift in our chart and look for things relatively easily. Now we're searching for things through the electronic record, which obviously takes some time. And so when we see a patient, especially as a specialist, we are very much dependent on what studies have already been done on that patient before they've come to see us. And so we need the records from the primary care provider or emergency rooms, or the results from blood work, laboratory evaluations, biopsies, x-rays, and all of those things come into our system very fragmentedly. I mean, it's you get a document that is scanned in, or you get a document that is electronically put in. Sometimes that merges with our system. And we don't know that. So when we are seeing a patient and now it's time for us to look back to see what studies have been done on them, we find ourselves searching and searching and searching a lot of times in our record to try to find that one piece of data that would be helpful for us. And so that has become challenging and actually does take quite a bit of time that we usually spend outside of the room seeing patients, because most of us don't like to spend that time when we're in front of a patient searching the record to look for things. So we have to do that either before we see the patient or after we see the patient. And it really is not efficient to some extent. So there are a lot of efficiencies in electronic medical records, our ability to get out orders and electronically prescribe medications and send our notes to primary care providers. All of those things are fantastic, but it's the data gathering that surprisingly is a tad bit more tricky than anticipated, and that's where most practices are looking for ways to simplify that if there is a way to do it, and that is truly one of the challenges.
Thank you, Joshi. Thank you, Dr. Joshi. I really appreciate your input into the challenges that you and other healthcare providers are facing. So we are, as I mentioned, an IT solutions company, and this particular area is of very significance to us. We want to make sure that we provide the right analytics and provide a solution that helps the providers as well as the payers. So let me walk through that here quickly, what our solution looks like, what is the overview of the solution, and then subsequently I'm going to jump into a demo to showcase how the application would look like potentially. So so the idea is, how do you get a 360-degree into patient health? And we want to do a quick webinar about that today. So the patient health information. Now I know that's a lot of information on the slide, but let me just break it down for you. When you look at patient health, there are four major buckets of information, as I call it, that is relevant. The very first one, medical records, I think that is the key element. That's what Dr. Joshi has talked about earlier. This is where you have information about a patient's medical history, the symptoms the patient is experiencing, the vitals, pathology, more and more information about the medical records. Now, obviously, this is not exhaustive, just a sample data elements that are part of the medical records. The second piece of information is claims. So this is the piece of information that gets exchanged between the healthcare providers and the healthcare payers. This is how the practices get reimbursed for the services provided. Now, claims is a structured data because there's a lot of financial related information in there. And also the claim record will typically talk about what are the diseases that have been diagnosed, what are the procedures that have been conducted, any prescriptions that have been prescribed if the patient uses it, and the labs that the patient have visited, and the payments from the labs. So these are the two critical pieces of information for the providers and payers. However, there's a third piece to it, and this particular piece segment is exploding more and more, as you can imagine. That's the personal health data. Now, there's also the traditional way of monitoring devices, like for heart conditions and some other chronic conditions. The data that comes back from the device is kind of siloed by itself. There is no easy way for the healthcare provider to get that information unless the patient himself accurately tracks it and brings it back. And there's a lot of data collected as part of the in-home therapy. There's a lot of data collected when there is a phone call that's placed with the patient, and they find out how the patient is doing, what kind of symptoms he's experiencing. All that data that is collected typically is in its own system. The fourth one is the social factors. So this is again something that you the provider may or may not have. Social factors are like your demographics, socioeconomic factors, lifestyle. As I talk to a lot of physicians, I understand that this is a critical piece of information that is going to help them provide better care. So that's a piece of information that may or may not be available within your medical records itself. What are the challenges? The data is out there, but what are the typical challenges? And I think Dr. Joshi rightly mentioned. One is the data is in siloed systems. Even within the medical records, I think there are so many different sources that you get the information from. Critical information is logged away in text records. Why is that a big challenge? In the IT solutions arena, typically, if your information is in a structured format, database type of a thing, it's easy to conduct more analytics and provide the information. But when it is information is in a text record, it is much more challenging to get the knowledge from it. And there's a lack of unified view. There's just not one view that is going to give a 360-degree view of what exactly the patient is going through. And of course, there is a pretty good chance of missing coding. There's always this coding gaps that the payers constantly complain about, and this is a lot of inefficiencies in the doctor's office and the and causes an administrative burden for the payers. What is the solution? At least what we are thinking, what we think we can provide is a unified view into patient information. We can extract structured facts and make it into useful information. We can search across multiple sources, both internal systems as well as the public domain. So that's a brief overview. And what are the types of applications for this solution? On the provider side, this could help in closing care gaps. You can integrate with multiple EMR systems, multiple sources that should help in better diagnosis. Value-based care, this is getting to be more and more important. And we can also help in spotting adverse drug reactions and interactions. As an example, how do you get this is now I'm getting into a little bit AI, artificial intelligence and machine learning domain. You can also do the relation extraction between diseases and conditions. We're not going to focus on that today, but the applications are very, very interesting. On the payer side, we could help with closing the coding gaps and cross-validate ICD codes with medical records and claims. This application solution could be used for call center support, get the information on the fingertips of the person making the call to the patient for any reason. This could help in risk assessment. You can do a better stratification or clustering of the patient populations. Can support audits. This can help create campaigns for targeted populations. Talking about the applications of a solution like this, it is a lot. But what we are going to focus today is the first two items, that's the medical records and how you can do that, how you can utilize that to provide better care. So let me jump onto quickly onto the application itself so that you can see how the application looks like and how it could be leveraged by the providers. Okay, what I'm showing you is probably a lot again to take in. I'm going to pause here for a second so that you can take a look around. This is a solution that we have put together, and this is of course a demo, not with real data, because we are very conscious about HIPAA regulations and PHI. So all you see, the data is of course a scrambled data. The names might look very similar to real names. The information might look very similar to real world information. That's because it's data that's real. However, it is scrambled so that the actual patient's information is not relevant to the underlying conditions that you see in the data, and so on and so forth. So yeah, so we take care of the compliance there. Now let me walk you through what you're seeing in here. There are broadly three sections in this particular application. The left side is the filter section, or what we call the facets. The facets are essentially when we look at all the information, how could we nicely slice it in a way that you can do further search into it. So as you can see on the medical records, some of the things that are critical or important are anatomy, conditions, encounters, immunizations, medications, the reasons for the medication, hypertension, diabetes, so on and so forth, modality, ultrasound, X-ray, so on and so forth. The observations are essentially your vitals that we have taken, that the physician has taken. Procedures, any procedures that have been conducted. And of course, the demographic information, race, gender, marital status, city, so on and so forth. A lot of this data is from Massachusetts, by the way. That's why you see Boston and all. So we can nicely organize the data and put facets out there, put the cards, if you want to think of these as cards, in nice little buckets that you can look at your entire population that you're treating. And, in this case, if this is used by a hospital, this could be for all the patients that the hospital is seeing. If it's used by a physician's practice, this could be all the patients that the physicians are seeing. If it is used for by a payer, that could be all the patients that are part of their healthcare plans. So, depending on the user, this could be built accordingly. So let me go through a couple of these things. You see the years in here. This is, if you want to go through all the medical records in this case, across multiple years, it's out there. Now, if I want to limit it to the last 5 years, I can just scroll down here and look at the data for the last 5 years. But let's not do that right now. Anatomy, if I want to look at, now this kind of analytics is going to help when you want to look at your entire patient population to, analyze how you can provide better care or, other use cases that you want to do. Let's say if I want to look at the arm, I want to focus on, what are the patient population that has come to see, that have come to take care of their arm. I can just click here and then it's going to automatically show up with all the patient medical records that have arm as one of the things. Today we are having a little bit Wi-Fi issues, so it's running a little slow. But typically the expectation is that this comes back pretty fast, just like Google does. As you can see, the actual query itself took 0.256 seconds, but the Wi-Fi kind of slowed it down. But now you can see that out of my entire patient population, I'm looking at the medical records where arm is involved. So that's one way to look at it. And similarly, you can look at the medications, you can look at immunizations, so on and so forth. So that's the left side of the screen. And the filter search is essentially to say that, okay, I want to look at a specific term. I don't know what I'm looking for. Like, let's say I want to look at Alzheimer's condition. I just start typing in Alzheimer's in here. It's going to show up Alzheimer's in there. So that's the filter search. The middle section that you're seeing right here is the actual data of, in this case, the medical records. Yeah. And there are two different views that we are providing here. One is the consolidated view. The consolidated view actually has one record for each patient. So that's why you do not see any kind of a repetition here. And then we also have a detailed view. If you click here for a detailed view, the individual encounters for that particular patient is going to show up. In the consolidated view, everything, all the records for that particular individual is going to be consolidated. Let me show you, like as an example, let's take Bryce Smith here. The quick view here will give you information. It's also nicely laid out. The patient information, any allergies if he has had, any medications he's currently taking, the conditions that he has visited the doctor's office for, the pre-diabetes, anemia, so on and so forth. What are the care plans that he's on, observations that have been taken, immunizations the person has taken, the encounter. So there are so many different encounters for this particular patient, from 2014 to 2017, 2011, 2019, and so on and so forth. So everything is consolidated, so you can have a quick glance at how the patient looks like. And then on the right side, what you have is analytics. This is where we provide additional value. So in addition to providing the ability to look at the records and search through the medical records, we also are providing analytics that could be of use. And all of this could be customized, by the way. All of these sections, how it looks like, could be customized for your individual needs. Quickly, we showed you a couple of analytics. How is your data population looking like based on the race? How is your population looking like based on the county? So as you can see, the Middlesex County has most number of cases. That's 23%. You can conduct further analytics and say that what is the population of Middlesex County compared to the remaining counties, and is it more or less? So there's a lot of uses that you can do down the road. Conditions. I can see that the normal pregnancy seems to be the highest rate of occurrence. That's good. No need to worry about it. Now the second highest is the sinusitis. The third one is anemia. So is there a pattern that I'm looking at? Should anemia be a major factor in here? What's going on? So that kind of discussion people can have. That's analytics on the right side. Now let's say that a patient comes in and I want to look at the information for that individual patient. I'm just going to type in Bryce, and by the way, you don't have to worry about the case. This is an intelligent search. We can take care of the typos, we can take care of the case, we can take care of many different synonyms for a word. So Bryce Smith here, I got it. As soon as I came in here, I said that, okay, Bryce is here. I got a consolidated view of Bryce. Now let me look at the detailed view of Bryce. That's going to go in and fetch all the individual encounters of Bryce Smith. As you can see, this is from 2014, and then it's from 2017. I can look at what is do a quick view now. There's a lot more information about Bryce in here because this is about one specific encounter. Observations, the encounters, allergies, why he came, and so on and so forth. So this gives a nice little detail. Now let's go back to the consolidated view. And let's say I want to look at the claims associated with Bryce Smith. All I have to do is click on the claims. That's going to open up a whole another tab because we want to provide the claims related information in a separate tab so that you can get all the claims related information. But if there is a need to integrate it and show it in the same tab, we can do that as well. So let's go over and look at what the claims look like. So there is a number of claims that has happened for Bryce Smith. We can go through any of these claims. We can do a quick view, the medical record ID, who is a provider, in this case, UT Medical. What is the program name? What is the claim type? That's an emergency department visit. What is the paid amount? $115. What is the paid amount for the institution? So you can get all this information. So let's get back here. Now, this is about Bryce Smith. Now, I want to say, let's say that I want to go back and look at the properties for Bryce Smith. I can do that. The properties is basically metadata. This is the underlying data that we are using. Okay, so here I showed you about medical records, but you can look at the claims, you can look at personal health records, you can look at social data, you can look at videos. We actually have a way to search through the videos as well, because we can convert the the speech to text, and then we can provide the search for that particular word that you're searching for. The all basically consolidates all the data across all these different streams. Now you can, I showed you how you can search by a patient, but you can also search by a typical word that if you don't know the patient name, you can look at that. Let me see. Let's say Angel Swift, this is across all of them. And this is the source, claims, medical records, videos. If you want to search for cancer, you can search for cancer, so on and so forth. But let's get back. I think let me just take a quick look at the time check. I think we are about 5 minutes into left for the webinar here. So I want to encourage everybody to start putting in their questions if they haven't already done it, so that we can I can take a few questions before the end of this. One last thing I wanted to show before I jump into questions is we have some analytics provided on the right side, but if you want to provide more advanced analytics, we can do that. So I've provided an analytics tab in here that's going to drop down and show you, like in this case, what are the encounters, the analytics for the encounters looking like. You can see that the general examination of the patient seems to be the highest number of encounters. You can look at immunizations if you want. You can look at covered. So from an insurance payer perspective, you can look at covered versus uncovered amount. So immunizations, I can see, okay, the influenza, seasonal influenza seems to be the one that has been mostly widely utilized by the patients. That's good. I have 76,000 records. I don't know if that's good or if I need to conduct further analytics. Total versus uncovered amount. How is the insurance coverage for the individual patients? We can look at that. But there are many different analytics that we can perform. But let's go back here, and I want to keep an eye on the time here. So I am going to get back here and stop my presentation in there because we have about 3 minutes. There's my email address, my phone number. If you want to take a minute to note it down, please do so, and we can get back to you if I'm not able to answer any of the questions. So that's the end of my seminar, and I'm going to look at some of the questions that have been posted and read through those questions, see how many I can take. Okay, the first question that I have is from a doctor. Does this require additional permission from the patient for release of the information? Great question. What we are doing is we are the IT solution partners for the providers and the payers. So any permissions that your organization needs to take, we are going to utilize the same framework. If there are any access that you currently have is what is going to be propagated into this particular solution. If we need additional permission, then that's going to be basically going back to you so that you can get the additional information, and we can provide information about what exactly is being exposed as part of it. Hope I answered that question right. The second question that I have is from Anonymous. I don't know who it is, but is the user interface customizable per the needs? Yes, very much true. That's a great question. I showed you a solution which showcases how the data is going to look like, but that is not all what you need to do. If your organization has a need to look at the data in a slightly different way, we can pretty much do that. What I showed you is a solution framework. Now, as an example, an organization that we have worked in the past, they wanted a very simple user interface. They did not want a lot of facets or cards right at the outset. they wanted a simple search bar, very similar to Google interface. We could do that. We could start from there and then kind of drill down. So yes, it is very much customizable. Next question. Next question is two questions. I think, can it be integrated real time with third-party systems? Is this software available for patients as well? So I'll take the first question, first part of that question. This could be integrated with a third-party system. That's the whole premise of this. Now, in terms of real time, that is something that we need to look at your specific need. Because typically this is done by indexing and we schedule jobs to refresh the data on a regular periodic basis. Now, if you have a real-time need, we can work with you to address that need. The second piece of that is this software available for patients. As I said, typically the solutions that we provide is more for enterprises or organizations. So we do not sell this software or the solutions or the services to individuals or end consumers. The next question. With devices like Fitbit capturing healthcare metrics, is this making its way to healthcare records? Yes, and I think that's the third piece that we were talking about, personal health data, because Fitbit and other Apple Watch, they started capturing more and more metrics about healthcare, about a patient's health. So we can very much utilize the data from there and integrate into this system. Let's see. Can artificial intelligence and some of the emerging technologies assist towards this 360-degree view of the patient? Yes, that's true. We use AI and machine learning extensively inside the organization. For the solution itself, there are a couple of places that we have utilized machine learning. You know, the queries could be learned so that they, when the next time somebody comes in, more relevant queries are given. And in terms of the AI, some of the analytics that I have not shown all of it, but some of the analytics that we could embed into this is we could do a disease extraction. I talked about adverse drug reactions. So those are some of the things that we could, and then predicting the likelihood of a particular person getting to become a high cost person. He may not be a high cost person right now, but he could develop into one in the future. So those kind of analytics we could provide. I think there are a couple more questions, but I think we are probably going to answer those separately because I'm a couple of minutes over the time. Thank you all for your time. I appreciate you joining this webinar on a Thursday morning. I know in this current situation with COVID, everybody's probably, a lot of people are working from home. I do appreciate you being flexible and spending your time, 30 minutes of your time with us. You have my contact information. Please feel free to get in touch with me. You have our website, intuiture.com. You can always get in touch with me. If you want to connect with me on LinkedIn, please do so. Thank you so much. Have a good day.